And I'm Ken Lanfear on Thursday morning with this week's Bronson Health Chat segment during this February American Heart Month. And just a quick reminder, tomorrow is Wear Red Day today in the Go Red for Women initiative during Heart Month. So pick your wardrobe out and find something warm and red to wear tomorrow. But our guest for our segment this morning is a physician at Bronson Advanced Cardiac Health Care to talk with us about heart health. Dr. Michael FACC is board certified in cardiovascular disease, comprehensive echocardiography, and nuclear cardiology. Dr. FACC, good morning to you this morning.
Good morning.
Thanks so much for joining us. Well, February is American Heart Month, as we've been talking about. What would you like to share with our listeners about the importance of keeping your heart healthy and seeking care when it's needed?
Well, throughout this last year, it's been a really challenging year that we've all felt. The studies have shown that though last year we've seen about a 25% increase in cardiovascular disease and death rates, even in Michigan, related to the year before. And certainly the pandemic has played a huge role in that.
Well, COVID, of course, is a big part of our lives right now. It's been almost a year now since it first entered our lives. How has COVID-19 impacted heart health and care during the last year?
Well, what we've seen is that initially, and even still so today, people are delayed in care. There's been a huge reduction in the amount of doctor's visits, cardiovascular procedures that are being done, or even people following up with their prescriptions or getting their blood pressure checked. There's been about a 20% increase in hypertension death rates over this last year as well. So we're just advising people to take care of themselves, come to your appointments, get your refills, and communicate if there's any issues.
There's been a lot of discussion about what COVID-19 can do to those who experience it. There may be more that we don't know that we do know, but do we know whether COVID-19 directly affects heart health?
It does to some extent. There are two main issues. There is an immediate issue, and then there's a delayed issue with COVID-19. The immediate issue is in a small percentage of patients, it can cause a weakness of the heart muscle. We think that could be transient. The long-term effects, however, are just the fatigue, palpitations, and ongoing shortness of breath that can linger.
We're talking with Dr. Michael FACC, physician with Bronson Advanced Cardiac Health Care, on our health segment for this week, our Bronson Health Chat. Dr. FACC, you had COVID-19, right?
Yes, I did.
Can you kind of share your experience and how having it may have changed how you look at this virus?
Well, I was a bit biased because I've watched what this virus can do for close to a year, watching our hospitalized patients and how they did. And then when I acquired COVID in September, it was certainly more nervous, if you will, just see how I would come through. I did come through well. Did not have any long-term issues that I could tell. It's something we always have to be cautious of.
On another note, Bronson Methodist Hospital has just been named one of the nation's top 50 cardiovascular hospitals for 2021. What does that honor mean, and how do you feel about the hospital receiving such a designation?
Well, we've always driven to provide evidence-based care and the best care possible to our patients. We did not even expect this award. It is nothing we apply for. It's just something that was recognized for. And for us, it's just an affirmation of what ourselves and our team has always driven to perform.
And how does that designation affect patients?
I believe it just gives them affirmation that we're trying our best to provide the best quality care, lowest cost with the best outcomes.
Well, we congratulate Bronson on that honor, and we thank our guest for our Bronson Health Chat segment this morning, Dr. Michael FACC, physician with Bronson Advanced Cardiac Health Care. Thank you so much for sharing some important information as well as your personal experience with us this morning, Dr. FACC.
Thank you for having me.